Hi, this is Emma Hemming-Willis.
And I'm Helen Cristoni.
Welcome to our Make Time podcast. We are two women on a mission to uncover the secrets of making time for everything.
From work and relationships to our brain, body, and beauty, we'll explore it all and share it with all of you.
We interview experts so we can discover more practical tips to make time so we have more time for our family, friends, and ourselves.
So join us as we chat with incredible guests who share their expertise on all the ways we can learn to make time, especially for you.
Okay, it's time to make time. Hey everyone, it's Emma and welcome back to the Make Time podcast. Today, Helen and I are joined by the incredible Dr. Bayo for a really important conversation about health advocacy and learning how to use your voice in medical spaces. We talk about why self-advocacy matters, how to communicate more confidently with your doctors, and how to manage the anxiety that so many of us feel around medical visits. Dr. Bayo also shares practical ways to advocate for the people you love and why prioritizing your health, even in the middle of a busy life, isn't something we can afford to put off. She also introduces her initiative, Clinicians Who Care, which is all about helping patients connect with compassionate, empathetic providers. This episode is about empowerment, confidence, and taking a more proactive role in your health. So let's make time for Dr. Bayo.
Hello. So today we have Dr. Bayo with us, and we are so excited to have you on the Make Time podcast today. So Dr. Bayo, why don't you tell us just a little bit about yourself so our listeners can get to know you a little bit?
So I'm a mom, a wife, a mom of two little girls that keep me going. I'm a family medicine doctor, which means I get to see all ages, all stages of life, and a health advocate. My love and passion is helping people know more about their health, but also what you can do about it. And it is a pleasure and a joy to be here with you and to just share health information. And I live in Reno, Nevada.
Well, we're so happy to have you here. We are now bonded because we are open field authors. Well, you're about to be, right? How's the book process going?
It has been fantastic. I'm learning as I go. I think all of us, there's so many uncharted territories, but Open Field, I can say, has just been an amazing, family. I have felt supported through this entire journey. I've also felt this ability to stay true to who I am. And that is what I felt from the get-go, because I'm a practicing family physician, and the majority of my patients may have taken two buses to see me. And so with Open Field, they understand that, I'm a doc first, and I see people and I help people. And that bridge of being able to bring my voice to pen to paper and share what I see in a clinic has been fantastic. So very grateful for this opportunity to help as many people as I possibly can. And Open Field is helping me do that. So yeah, living in gratitude.
So I feel like this is a good segue to talk about some of the things that we should be making time for, because this is really around the synopsis of your book. Do you want to talk about that?
I do. So my book is centered about how to talk to your doctor, how to advocate for yourself. All of us know that there's a lot of information out there, and it can be really hard to figure out, what do I do with it? How do I move forward? And even a great example is, you'll hear, okay, I need to know more about my health. I need to stay healthy. I need to do X, Y, and Z. But when you go to your doctor, it can be very difficult to first get that information, understand that information, and what are the next steps. And my goal with this book and everything that I do is to provide practical tips that help you first have that conversation, because a good example is, you can have the most education, you can be well-traveled, well-versed, but when you go into your doctor, there is this invisible kind of vanishing thing that happens because of a power dynamic that just automatically happens, where you go in, you have these things that you want to share, but then all of a sudden it just like evaporates. So my hope is to give you that power, that agency back of whatever's bothering you or your loved one, that you can share that in a way that speaks to your doctor. And so then you can get those concerns, those worries met with answers. And what are your next steps? And that is what I love to do.
Yeah, I mean, I think it's so interesting because, currently here in the United States, it's so hard to even get in to see your doctor, number one. And then when you get in, you're so stressed out because you finally got there and it's been 8 weeks or whatever for you to wait to your appointment. You have this little window to get it all in, and the whole thing is stressful. Getting in to see them, when you're there, they send you away with all this paperwork. Like, what does it even mean? And so I'm so excited we're talking about this today because I think it's a really important issue. And so for women listening that want to make time to advocate for themselves, their families, can you give them like 3 very actionable tips on how to advocate for themselves?
Yes. So let's just start first with the doctor's appointment. Most of them are about 10 to 15 minutes long, which can be very challenging to be able to get your questions answered and even know what you should do after you leave that visit. So the first thing I ask people to do is to advocate in a way that writes down, like, what are your concerns? So before you even have your doctor's appointment, write down your most pressing concerns and make it to about 2 to 3 things that you really want to talk about. That way, when you see your doctor, you can maximize those 15 minutes and even lead with this kind of conversation. Say, I have 2 to 3 things that I really want to talk to you about. And that helps that doctor kind of have, the starting point. Okay, these are the 2 things that are most pressing to you. So that's the first thing. The next thing is, after you're having that conversation with your doctor, often you're given labs or tests to follow up. I encourage everybody to use this language. Help me understand why you have decided to have me get this blood work. Help me understand why I need to have this test. The reason why I love that language is you're sitting there, you're being told, I need to do this lab, this test. And often you're like, why? Why is this happening? So that invites a conversation to say, okay, they are testing this blood work for a thyroid or for cholesterol. And that allows you first to say, okay, we're on the right track, or B, we are not on the same track because this is not what I'm thinking for. And then the third thing that I think is very powerful is before you leave your doctor, I ask everybody to say, what are the next steps? Meaning, in 2 weeks, I would like to know, do I have a follow-up appointment with you? If I get the blood work, what should I do next? And a real tangible way to do this is first, make a list and say, this is what I'm responsible for when I leave the doctor's office, and this is what my doctor is responsible for. So I think those 3 things can be really powerful and maximize that 15 minutes that you have with your doctor.
I also think, like, when you leave, I know for me, it's one thing to write it down, but I also like to do reminders in my phone, that'll beep in 2 weeks that, this needs a follow up. I think that that's important just as reminders, right? Because time just goes by and then you forget, like, oh, I was supposed to do this test or I was supposed to check in here. But I think it's important either if it's to write it down in a notebook or just put a reminder in your phone.
Absolutely. And one thing that you can do is even before you leave your doctor's office, you can say, because sometimes they'll say follow up in a couple of months. Instead, schedule an appointment for 2 to 3 weeks. I tell my patients when they go and see a specialist, right there, schedule and say, are there any openings in 2 to 3 weeks? Now, if you decide that you don't need it, you can always cancel that appointment. But you're in that moment right there. And often there might be some appointments that are available. Most doctors have like 10 minutes, 20 minutes that are considered acute visits when you're already established with that doctor. So grab that appointment. That's huge. And just like you said, Emma, having those reminders on your phone is really helpful. And the other thing that I think is a powerful piece that I think is underutilized, I call it your medical playbook or your medical notebook or binder. And so I have all of my patients write down, the symptoms that you're experiencing, the diagnosis you received, what your doctor shared as far as what they think it is and what you think it is, because that gives you this living piece of information about your health as you navigate your health or even your loved one, your kids, everybody.
Yeah, I mean, I'm the worst person at this. Yeah. So for people like me who are really just, I hate going to the doctor. And
why?
I just do because I don't have.
I was going to ask you. I'm like, can I lean in?
It's because I'm scared. I guess I'm scared. Number one, I'm scared of going to the doctor because I don't really know why. I have a great doctor. I love my doctor. So no offense to my doctor if she's listening to this, but it's like, I feel like it's almost a chore. I'm just going to put it out there. Mm-hmm. And it takes a lot of time. I feel like I'm always waiting for hours. The follow-ups are overwhelming to me. And especially as I get older, like the list of things I have to do grows. I feel like, I'm going to put it all out here. I feel like insurance is a complete pain. I'm always like, oh, you still owe I swear every time I go to the doctor, I pay my copay. Like I put my credit card down and then when I call up, they're like, oh, you still owe a copay. I'm like, how's that possible if I pay you every time? I'm not not paying. And so it's just it gives me, I guess I have doctor anxiety. So
what's it called? Like white coat anxiety?
Yes. There's a real name to it.
Okay. Yeah. So for us white coat anxiety people like myself, break it down for us. How often should we really be getting in? I'm 55 years old. So how often do I need to go? And what do I need to do?
So the first thing I'm going to recommend is writing down, and I know, like you said, that anxiety, what really is important to your life, your lifestyle? What do you want to achieve just for your overall health? And when you memorialize that, it helps you kind of quell a little bit of those fears, because then you have a goal of what you want your health to be, what you want to achieve. And that is powerful, because then when I share going twice a year can be very helpful, you can connect those dots. Yeah, I want to be able to go on more vacations. I want to be able to, run a marathon. And that way, when I share going twice a year, getting the blood work that can make sure that your red blood cells, we can check to make sure you're not anemic. All of those things kind of connect the dots and make it feel real and in tune to you versus just these random, okay, come twice a year, get my physical, you listen to my heart. But when you kind of dig a little deeper and you're like, yeah, I want to go to that wedding. I want to make sure that I'm good to go for my overall screening, for my mammogram, all of these things that are important to me so I can go to this wedding that I want to go to. So for you at age 55, I would definitely recommend at least twice a year. That way we can catch things early on before that 1 year. The other thing that I would recommend, and I do this with all my patients, if there is anything that is out of your baseline where you're like, I'm having more headaches lately. Oh, I've noticed that I'm bloated more. I want to know, and I want you to come in sooner rather than later, because I think as women, we tend to think, oh, it's just nothing. It could be something, it's going to go away. Well, it may not go away, and maybe it will, but I want to know. I want to check, because there's so many different diseases that we know, especially with women, that are very subtle until they become not subtle. So my advice is you're going to write down first what's important to you. We're going to do twice a year, and then anything that isn't part of your baseline, I want you to be seen, and just let's check it out.
So would you say a yearly physical is not enough? So what you're saying is twice a year you should be seeing your doctor.
Absolutely. I believe I do not prescribe to once a year because I will see people who will say, well, I waited the year, I already saw you. This came on about 9 months ago. A great example is I had a woman who had just come in for her annual exam. And 6 months later, she shared with me, and I'm so glad she came in between, but she was like, about a week after Dr. Bayo, I started experiencing stomach pain. And I just thought, well, I just got checked out. I'm fine. Everything's okay. Well, it got worse. Then she noticed she was having more bloating. She was having, and I'll just say it out here on this, she was having diarrhea and then constipation. It was going back and forth. And I do this thing where I just check up on you. I call people. I'm like, how are you doing? And so I found out that's how I was able to intercept and say, I'm like, I need you to come in now. And so we ended up getting a colonoscopy. We found out that she had colon cancer.
Wow.
But in that story, because sooner rather than later, that changed the trajectory of that, I believe personally, what that grade of that cancer could have been, because 6 months later, that could have changed the whole nature of it. So 100% for me personally, do not prescribe to once a year because things change. Just because your blood work looked normal at year 1 doesn't mean 2 months from now that it couldn't have changed.
Yeah, it's so important to stay on top of it. I mean, we always say, prevention is better than cure.
Yes, that's what I'm in it for. I love helping people, and I love helping you hopefully prevent, a disease, a condition, a symptom. And the other thing that I love doing is honoring people. I feel so privileged to be a part of people's lives. And I tell my medical students and residents, being a doctor is the best job, I personally think, ever to hear people's, most intimate things and to try to help them. And if I can help you stay healthy, that makes my heart so full.
I want you to be my doctor. I'm coming to you.
100%. I'm all in. I'm like, well, right away when Helen said, I'm like, oh, let me, I would like to help.
Can you just call me? Dr. Bayo,
I will be giving you my number, just so you know. I really love it. I love being a doctor. It is
the first way to change things. And I'm just being honest about this because I'm that person, and we encourage women to make time for things. And this is just something I'm self-admittedly very bad at. I'm very I always push it off. I cancel. It's how far out can I kick the ball? I'm that girl and I shouldn't be that girl. So I'm trying to change. So thank you. I have another question. I think as it relates to, when we have our children, adult children, our spouses, when they have situations happening, what advice can you give people that are advocating for a loved one? Because it gets really tricky, especially my daughter had mental health issues as an adult child, and I had to advocate for her. If I had to, advocate for, my husband, our husband, what advice can you give people that are listening when it relates to advocating for someone else?
Yeah. Also, so just to add on to that, for me and my husband, it was very hard. It felt very unethical for me to go above his head to speak to his doctor. And what do you suggest? If you are noticing something with your spouse, maybe, for us, it was FTD. It was a type of dementia. What do you also suggest for people to kind of get to their doctor around them so that we can help them?
Hello, lovely ladies. Are you ready to take charge of your wellness journey? Look no further than Make Time Wellness. We've worked tirelessly to develop delicious all-in-one drink mixes that make a woman's daily wellness easy and delicious. Make Time Wellness supplements offer comprehensive formulas for your brain, body, and beauty in that order without having to take handfuls of pills. Make Time is packed with powerful ingredients like MCTs, omegas, biotin, multivitamins, and curcumin. Our formulas are designed for busy women by busy women. Check us out on maketimewellness.com/podcast20 and enjoy 20% off your first purchase. Make time for your brain, body, and beauty with Make Time Wellness.
This is a situation that so many women, there's a data point that says that we are the decision makers, over 80%. We are the decision makers in our household for our loved one. We are the people who are helping our loved one get to the doctor. So for someone in that situation, and I'll give my personal example, I was the caregiver for my father. The first thing that you can do, and I know everybody's situation is unique, is if you can have a conversation with your loved one and say the words that, I know something doesn't feel right, and I would like to be able to advocate on your behalf, because that allows that person to feel a part of it. Instead of exactly what you said, Emma, instead of separate, instead of feeling like you are going over their head, instead, we are doing this together. And I would love to be able to share what I see. And sometimes, there is that buy-in immediately because they know you, they know that you love them. And so having that conversation in advance can be very powerful in the exam room. The other thing to do is, and I'm going to give two pieces of advice. I had a 65-year-old lady who came in with her 25-year-old daughter who was experiencing some changes in behavior. And the daughter actually called me in advance and said, these are a couple of things that I would love to talk about when we're in the exam room. And she had already had a conversation with her mom in advance, but she wanted to let me know. So if you're in a situation like that, calling your doctor and saying, because often women, we are already on that HIPAA, we're already on that approval. So you can call in advance and say, these are the things I'm concerned about. The other thing is having safety words with your loved one. For example, so I had another patient who had a caregiver, and they decided that there were certain things that they didn't want brought up in that exam room. They didn't want to bring up their lifestyle changes as far as like smoking and other things like that. But they were okay if they brought it up. So now they have a playbook. They come into the exam room. I already know what's going to happen, and each person gets to have their voice. So those are real ways that you can advocate for your loved one when you're in different situations. Call that doctor in advance. Have a plan with your loved one before you get in there. And then let's have a debrief. When you guys go home, what did you like about that appointment? What do you feel wasn't mentioned? And both people need to talk. I think that's really powerful.
Yeah, no, I think that's great.
I think also, people are given sick days, and so many people don't use their sick days. And so I think that utilizing those sick days to actually make time to go to your doctor's appointments is very important, because at the end of the day, when you're working at a company or something like that, you lose them. If you don't use them, you lose them. And, going to the doctor is a perfect way to use your sick days instead of just losing them. And so I really think use the time your companies are giving you to go see your doctor.
Yeah, hopefully you can get in.
Yeah.
So I agree. A phrase that I love is your health is your most prized possession.
Yeah.
So when you are in a situation with your work and everything else like that, all things stop when your health stops. So as demanding as your job is, as demanding as things are happening around us with our family and so forth, everything stops when your health stops. It doesn't matter what your disease is. When you have a disease, it doesn't matter what meetings you have, it will stop. And so I think if all of us can remember that, and that helps it become more of a priority, that you want to be able to be your best self. And in order to do that, you need to put your health first. And that means taking that PTO day to go to the doctor. Yeah. And I think not only the doctor, but what other things that are important to you, because that mind, body, and soul, they need all of those pieces to be healthy. So that PTO day could be going for a hike. That PTO day could be, taking 20 minutes out of your time to listen to music. So there's so many areas that we can help ourselves have better health. And I agree.
I'm leaning into that now. I think like making time to take time off to go to the doctor's appointment and then giving yourself some sort of make time award, lunch with a girlfriend, going for a hike. I'm in now.
Yeah.
Yes.
Love it.
Yes. I do prescriptions. I've done this many times where, and maybe I should do make time, but like for me, for especially women in my practice, where I'll prescribe music, I'll prescribe sleeping in, I'll hand it to them. Like I'll hand an actual prescription and say, this is your prescription to spend time with yourself. This is a prescription to listen to your favorite song. Like,
I think that's great.
It's huge.
Because you're giving that person, your patient, permission, which is what we need sometimes. And we do need to hear it from, our doctors. Can I just go back to one thing? What if you are going into your doctor's office? I know it's not going to be you because you seem like you want to get to the bottom and hear and understand what is happening or occurring to the patient. But what if a person is going into their doctor and they are getting dismissed? This was something that happened to me with my brain fog, and I was going to my doctor and I was saying, I'm experiencing this brain fog, and he kept dismissing it. Oh, you're tired. You have mommy brain. You have whatever it is. And I just feel like I wasn't being heard, but I didn't know how to advocate and be like, hey, buddy, listen up. I ended up leaving this doctor and then going elsewhere. But how do you get your doctor to listen to you?
So the first thing is when you hear when they tell you things that are not serving you based on what your symptoms are, I like to lean into this phrase still. Help me understand why you think my symptoms are not to be concerned with. Help me understand why you think that this is just mommy fog or brain fog. And I would like to know what other things it could be besides this. I think those are really powerful words. Now, if you continue to get dismissed, that's when, of course, you want to seek out a new doctor. But that language can be very powerful because then it puts your doctor on notice because every doctor, I'll give an example. If you see me, Emma, and you come in and you're like, I'm really tired, I'm having a hard time concentrating. Automatically as a doctor, I have a running list. We call it a differential diagnosis in my head of 5 things that this could be attributed to. And in that list, as you're telling me more symptoms, I'm ruling things in and I'm ruling things out. And so by sharing this information right now, I'm hoping everybody feels empowered with that. And if your doctor is like, well, I don't think it could be anything. This is just, I don't like the word, this is just fine, because that does not exist in my practice. And so if you're met with that, say, well, I would love to know what other things it could be. Help me understand what other things you're ruling out that you don't think it could be. And that really, again, puts them on notice and say, I would love to be tested for the things that you don't think it could be.
Yeah.
Could we run additional tests on that? And so that language, when you are dismissed, is very powerful. The other thing that you can do is, okay, so you don't think it's anything. What is your plan in the next week or two if nothing changes? What should we do now? What should we check for? Because then that shows like, okay, so you want me to wait a week or two? I'll wait a week or two. Nothing has changed. So obviously there's something else going on. I think that's powerful.
What's next?
Yeah. What's next? I love that.
And then also, the other thing is I have a lot of information. I get so excited. Bringing someone in with you as a witness can also be very powerful to help you advocate for yourself. The other thing that I think is underutilized is asking your doctor. And, I know there's an error right now of people privacy and so forth. But I don't mind when you come to me and you record what I'm sharing with you, because I know in that moment, it can be hard to digest and process what I'm saying. And if you don't feel well, if I shared news that wasn't news that you were expecting, you're just in a fog trying to listen to it. So if you can go home and process it and listen to it again and then be able to take notes, that's powerful. So those are some other ways.
Yeah, that's what I also say in my book, is that if you know you're going into a big appointment, have either a family member or a friend come. Usually I'd probably say a friend who can take the emotions sort of out of it, so that they can be there as your note taker, as you're going through and sifting through all this information. That's a lot of information. You have someone else there just to take notes and, help you with that.
Yeah.
It's so important and beneficial.
Right. And then don't stop. And the last thing I have to say is, do not stop. If someone is dismissing your symptoms, trust your gut.
Yeah.
We know ourselves best, and keep persevering, keep advocating. And I'll just share my story. A lot of people don't know. They know that I am a health advocate. They know that I'm all about helping people. Well, I have a couple of stories personally where I was dismissed, and it has fueled my fire to help as many people as I possibly can. And one of those stories was when I was giving birth, after I gave birth to my second child. And I came out of the operating room and I knew something wasn't right. And I shared with my nurse and I said, something's wrong. And she said, Bayo, you look fine. And I was having a hard time concentrating, talking. So I said it again. And 30 minutes later, she was like, nope, everything, your vital signs look fine. Well, I had my husband use my phone because I had privilege to privilege as far as having his number in my phone, and call my doctor. And he came and I advocated. I said, something isn't right. And I was taken back to the operating room. I was bleeding internally. And a lot of people are aware of the statistic of Black women dying at the highest rate during childbirth or shortly thereafter. And I nearly became one of those statistics. So share that story to let others know that I hear you, I see you. And that's why it's part of my mission to help people advocate for themselves, because it is life-changing. And I had the most access in the world. And, so yeah.
Thank you for sharing.
Powerful.
Yeah.
Very, very powerful. And, thank God everything. Thank God you knew to speak up. And this is the whole point, that we're making time for advocating for our health today. So
Absolutely. Yes. And so, and one other thing that I'll share with that history of dismissal and so forth, because I'm all about action, what can I do? And I, of course, with the book and everything else that we're doing, but I recently launched, and I'm so excited. 3 weeks ago, I shared my story of dismissal. It was actually another story. And when I did, the comments that came in were, of course, people sharing that they were gaslit and dismissed. But the other beautiful part was people were sharing the names of doctors who believe them. Because in my story, I share it takes one doctor to believe you. That can make a huge difference. And they were sharing the names. And so then I thought, what can I do with this? And so I came up with Clinicians Who Care. It is a free, crowdsourced, patient-recommended list that connects people with doctors who've been shown to listen, care, and believe their patients. It is a patient-recommended list, a people-recommended list, meaning people will come in. It's very easy. You write down the name of the doctor, you write down the specialty, or it's a drop down, and then you write down how that doctor made a difference in your care. And this list is free. It's available. And so think of how many times you call someone, hey, do you know an eye doctor that was that you like, that made a difference? But why not put this in a form that people can access? It's like Yelp for restaurants, but this is centered on patients and their thoughts. So I launched it 3 weeks ago. We have 1,700 names.
Wow.
We are worldwide.
Wow.
When I launched it, I just put it out there. My husband created a Google form. And so then people were like, oh my gosh, I have a doctor in Canada. Can you make it worldwide? I was like, I think so. And so we did. And so now we're in Canada, we're in Europe, we're in Australia, and it's a community all centered around helping other people find a doctor because we know there are good doctors out there, but it can be hard to find them. And so this helps you. It won't fix everything, but my goodness, it gives you a starting point because that way when you walk in that door, you know that doctor will believe you. And it's just been beautiful. So we're just doing it.
Wow, Dr. Bayo, I mean, it's so great to hear someone that's so passionate about the care of their patients and for like just spreading that around. I just been great. We always love to ask, what are you not making time for that you're going to commit to make more time for today?
Exercise and dancing combined. I love to dance. And I grew up ballet, jazz, hip hop, all the things. And so this week and last week, I didn't make the time for that. So I am going to commit today to doing a dance and and just exercising. That's what I'm going to do.
I love it. Make time to dance. I love it. Like no one's watching. Let's add that.
Yes.
Where can we find that list that you were saying? I would love for our listeners to know how to tap into that.
Yes, it's clinicianswhocare.com. You can find it there. You can also find it on drbayo.com, spelled all the way out. And the list, you can enter the name. It's very simple. Like you enter the name of the doctor, the specialty, and write down in free form, or you can click and see the entire list. I even did a little tutorial video that helps you organize the list by city, state, and country. So clinicianswhocare.com. And I say, each name added to the list or each share of the list can make a difference or be a lifeline for someone who's struggling to find a doctor to believe them. And it is my pleasure, it's my joy to just put something out there that can help people.
So, Dr. Bayo, thank you so much for coming on today and sharing all of this knowledge with our listeners, our Make Time movement girls that are listening. So we really appreciate it. We know you have your book coming out. We're so excited for this. How can people find you on social media?
Yeah, well, thank you for just having me. I live in gratitude. So I'd like to extend a level of gratitude to both of you for the opportunity to share health information to help more people. So that's what I just want to start with first. But you can find me on Instagram at dr.bayo, spelled all the way out. TikTok, I'm everywhere, LinkedIn even. And then my website as well. You can see the resource. And the book is coming out June 2026. And I'm just so grateful to be able to help serve more people and help more people. So thank you for having me.
We're so happy to have you on. And when your book comes out, please stop by here. We'd love to be able to talk about it and do all the things. Thank you for your work. Thank you for caring, showing up for your patients, for all of us. We are so appreciative.
Yeah, thank you so much for making time.
Thank you.
Thanks for joining us today. We hope that listening to our podcast has empowered you to make more time for yourself. So please remember to subscribe and share with a friend who could also use a healthy reminder on the importance of making time.
Make sure to tune in as we will continue to have incredible guests that will share their Make Time tips on our upcoming episodes. Come say hi to us over on @MakeTimePod on social media or visit us at maketimewellness.com.
Until next time, make time.